Hello, my name is Deborah, and this is the first of several podcasts that I intend to share with you. I want to talk about a variety of health topics and how massage can help each of these different topics that I'm going to be sharing. Today's topic will be on diabetes and massage therapy. Let me first tell you a little bit about myself. I am a registered nurse and I have my bachelor's degree. I am currently working as a traveling nurse and I work in hospitals on the medical surgical floor. And within that unit I can care for patients that have diabetes or are on dialysis. Many are pre- and post-surgical patients. Some have communicable diseases such as influenza or pneumonia or even shingles. And on that floor I can also care for patients who are in hospice care. It's very rewarding and it gives me an opportunity to really learn more about people and where their health issues have led them, which is to the hospital. I'm also a licensed massage therapist, and I enjoy this work very much. I am currently working part-time at a spa in Hudson, New York, and I enjoy meeting a variety of people. Most people are very healthy and proactive in what they want for their future, and that's why they make a regular habit, perhaps monthly, if they're able to, come and receive a massage. During the massage, it's usually a 30 to 90 minute session, and at that time I can listen and feel what my patients are going through with both my ears and with my hands, so I can ask some basic questions about what their health issues are currently, and then during the massage I can feel if there are any unhealthy holding patterns or if there's any underlying tissue damage. Sometimes when we overuse a muscle, it can tear, and then when it repairs itself, it may not line up exactly where we want it to be. And so in my being able to assess these areas, I can use different techniques to correct or help the body to repair itself in those areas. Starting out now with my topic on diabetes, I'd like to start out with a definition using the Mosby's Dictionary. And it talks about diabetes mellitus, the two types that we've probably all familiarized ourselves with. And the definition follows: diabetes mellitus is a complex disorder involving the body's inability to digest carbohydrates, proteins, and fats. So either the body does not produce insulin at all, and this is known as type 1 diabetes, or the body produces insulin but does not produce enough or does not use it efficiently, and that would be type 2 diabetes. And this would be what the greater majority of people with diabetes would have. The type 2 diabetes is controlled primarily by diet and exercise, and if that's not sufficient, then they would use medications. It could be oral or it could be injections, and it's an insulin medication that they would need. If the person does not get their blood sugar under control, diabetes can lead to some debilitating consequences for the eyes, the kidneys, the extremities such as the lower legs and the feet. It can also disrupt the vascular system, so the blood flow, which brings oxygen-rich nutrients to the cells. And of course, if you decrease the circulation to cells, then cell death will occur. And this can be seen with gangrene. Some people have lost toes or lower legs because of this decrease in circulation. And the area of the eyes can be affected in that the vision can decrease or complete blindness can occur with diabetic retinopathy. And what happens is, usually if a person has had diabetes for greater than 10 years and it's been uncontrolled, you can start to see floaters across your vision. There could be distortions or blurred vision. And what's happening is typically aneurysms, or a swelling of the arteries that lead to the eyes and that are flowing towards the retina, or the area which allows us to decipher color. And so again, this is something that would need to have either surgery or medications to correct so that it doesn't become worse. And these are some of the typical things that can happen when diabetes is left untreated. A person with diabetes can develop cellulitis, and usually this occurs in the lower leg area, the calf region. You'll see some swelling, redness, there can be some heat, it could be dry and cracked skin. If this skin disorder is not cared for, the bacterial infection could spread through the bloodstream, causing sepsis, leading to hospitalization. I've seen this with many diabetics that I've cared for. People as young as in their 40s and 50s having to have regular wound care to their lower legs because of the diabetes, not allowing enough circulation to the area, not bringing nutrient-rich fresh blood to the area. The circulation has deteriorated because of the diabetes, and healing is decreased or slowed in a person with diabetes. So all of these effects on the body from diabetes is something to take serious and should really motivate us to work harder to control our diabetes. A person who has diabetes and who is mindful of dieting and exercise, and if they're on medication, they're consistent with that, they typically will not see these types of issues because of diabetes. I'm sharing with you things that I've seen in the hospital because I don't want that to happen to anyone who's listening. So these are consequences that do happen from diabetes if it's left uncontrolled. Massage therapy is a very good avenue to avail ourselves of if we have diabetes. Again, if a person has controlled diabetes, they can have a regular massage like anyone else with no concerns or contraindications. A person that has uncontrolled diabetes would probably want to see their doctor and bring in a medical clearance so that the therapist caring for them can do so without concern for any major surprises along the way. The therapist and even a nurse is not going to diagnose a person as having diabetes, and we're not going to prescribe what a person should be taking for their diabetes. But what we can do is make a physical assessment by looking at the person who's on the massage table. Typically they will undress enough that we can get a really good look at their toes, at their lower extremities, and see if there's any changes that maybe the person's not even aware of. Unfortunately, I have someone that I know who went to the podiatrist yearly as anyone with diabetes should, but they didn't closely watch their diet. They did not have a regular exercise routine. And one day they just didn't feel right, and they went to the doctors, and when they took off their shoes and they took off their socks, one of their toes had become blackened because of a lack of blood flow and had actually fallen off in the sock when they took it off. And so if a person has a regular massage, this is going to allow the therapist an opportunity to take a look at them and warn them that, hey, something doesn't look right here, before it does get to that critical stage. So again, massage therapy can really help a person by assessing if there's any coloration changes to their toes or to their lower legs, and then just let them know, if they're not aware of it, that this is something they'd want to go and see their primary care provider about. We also should talk about low blood sugar. This can occur between meals, and so we encourage those with diabetes to snack between meals, but to do so with sugar-free foods or low-caloric foods. And the whole key with diabetes is to maintain a consistent blood sugar. Typically, the range is from 70 to 110. When you do a finger stick and you check your blood sugar, that's the range that we want it to be at. Most of the people that I see, they have it at 200 or lower. We certainly don't want it to be lower than 70. That can be dangerous as well. So when a person comes to receive a massage, we want to remind them that massage can lower blood sugar, and so if they're taking medications or if they have any sugar candies available, just in case their blood sugar was to go too low. But again, a person that has controlled diabetes typically does not need to worry about that. So a person with diabetes, I would encourage to see a dietitian who can help them to come up with a plan that will allow them to have the controlled blood sugar levels. Typically they'll be on a consistent carb diet, whether it's a low carb diet or consistent would really have to do with what their age is, what their health is, even their sex, and what their primary care physician has recommended along with a dietitian. The whole key is to have enough in your system so that your body is using that as an energy source. I've had a very learning moment with a young girl. She was in 5th grade. I was the school nurse, and I went with him on a class trip. And she needed to be closely monitored because her blood sugars would typically run in the 300 and 400 range. She was definitely eating candy along with her friends on the bus, and she just didn't take the diabetes very seriously. Her grandmother was her primary caregiver. Her father was in her life, and her father's girlfriend had a child with diabetes, and she gave the advice that all you have to do is stop eating carbs and you'll be fine. That is definitely not something that anyone with diabetes would want to do without talking to their primary care provider. Carbohydrates is a necessity for the body to take in and then use as its primary energy source. If you eliminate carbohydrates, your body will use fats as its energy source, and this can release ketones, and when that builds up, it can lead to acidosis, or a very dangerous pH level within the blood system. So that moment with the young lady was a learning experience for me, that there are so many people that are being misguided about diabetes and proper care of their diabetic condition. So a person that's receiving a massage, we would want to keep in mind when was their last meal, when did they last take their medications, if they're using any medications for their blood sugar. And this information is important to prevent a low blood sugar, or what is known as hypoglycemia. I would like to share with you an important picture that we've been using within the medical field. And this highlights some of the symptoms that could be seen in someone with low blood sugar. And so it mentions their shakiness, fast heartbeat, sweating, dizziness, anxiety, hunger, impaired vision, weakness or fatigue, headache, and irritability. And these symptoms, any one of us could have them at any time. Someone with diabetes, these symptoms would come on suddenly. It would be a change in their reaction from what they normally were 5 minutes ago. And it mentions to treat someone with low blood sugar, you would want to share something, a glass of juice would be very beneficial if they're awake and they're able to swallow. It mentions to use a candy source, but not chocolate. So chocolate would not help someone with low blood sugar to elevate it because it has a high fat content and fats take longer to absorb. So that would not be something you would use, as mentioned in this handout. Why would a person with diabetes have hypoglycemia? Maybe they didn't eat anything. Maybe they overused the medications. They forgot that they've already taken it earlier and they took more than what they should have compared to what they have ingested in food. Or maybe they had excessive exercising routine before they came in. So these are some things to keep in mind about low blood sugar, what could cause it and how we can treat it. So now, how do we have the optimum massage session for someone with diabetes who does take medication? It mentions in pathology that we would want to give the massage between meals. So if someone had lunch at 12 and they're anticipating having dinner at 5, in between the meal, which would be about 2:30, that would be an ideal time to come in for a massage because you've eaten something, you've taken your medication, it's had time to work, and at that point they're more likely to be stable for the massage. And again, this is really talking about someone who does not have controlled diabetes. A person with controlled diabetes, they're eating, they're using their meds, and their blood sugar level is stable. And once again, in giving the massage for someone with diabetes, we'd want to consider their skin, because a person with diabetes, if they're taking insulin injections, they're gonna typically be using their abdomen, and they rotate sites, so it could be the upper abdomen, lower abdomen, the right or the left. We want to ask them if they're using insulin and where do they inject this, so that we as a massage therapist avoid massaging over that area because the tissue is already being compromised from the injection, and that's why they rotate the sites as well, to prevent scarring and over use of that area of the skin. Also, we would want to consider their feet. If they have decreased sensation in their feet, typically that will happen because of the circulation. They're not getting enough down to their lower extremity. So if their feet has a decrease in sensation, we don't want to use a lot of pressure because they would not be able to communicate back to us that it's too much pressure. So that's something to consider with someone with diabetes. Also, they can develop wounds known as diabetic ulcers. Typically, this will be on the heel of the foot. It could also be on the ball of the foot or on the side of the foot, wherever it may be rubbing against a shoe. or maybe they just have poor posture, and so that area can be irritated. So in giving a massage, we want to ask if they have any open sores, and we would avoid those areas during the massage. Some benefits of massage therapy with someone with diabetes is increased circulation, assessment of their skin, communicating any concerns that we may come across during the massage. Also, the massage therapy will help depending on the type that we use. If you look at the ankle as a whole, there are bones there are ligaments, there are many, many muscles that help each of the toes to move. And so during the massage, we can do what is known as passive range of motion. So the therapist will be moving the ankle in all four directions in which the ankle is naturally able to move. And by doing this range of motion activity, it increases circulation and it can increase mobility for the person that's receiving the massage. And certainly we would want to encourage the client to do active range of motion, to do the movements that we're doing when they're at home. If they're watching TV, take a few minutes to move those feet and ankles around just as we have shown them in the massage. And so improved circulation, improved mobility, improved blood flow, those are some of our major benefits of massage for someone, for everyone, but even more so for someone with diabetes. Types of massage that I would use would be some stretches, some ankle rolls, some myofascial release. We can also do the Swedish massage, which will increase circulation. Reflexology, we have the book here that I've been researching about different points on the feet that can be used to improve the pancreas and its ability to function more efficiently. We can do abdominal massages to improve digestive health. And again, that's if they're not receiving injections in the abdomen. And so the therapist will want to speak to the client and ask what is their preferences or what are some massage modalities that they've had in the past that they've enjoyed, and we'll work together to personalize the session. In the reflexology book that I pointed to, there's a lesson describing the importance of the pancreas in maintaining a balanced blood sugar, and it highlighted the pancreas releases the hormone insulin, enabling the body cells to use glucose, also known as our blood sugar. And so reflexology can lead to healthier glands, a balanced chemical reaction, and this is a desired effect. Another concern for those with diabetes and everyone would be stress. Stress can elevate blood sugar and it can elevate blood pressure. So all of these problems that we come across can be assisted through massage. Massage has been proven to lower stress levels, and it certainly helps with the mind-body connection. If our body is working well, then our mind is functioning properly, the two will provide a state of peacefulness and an improved efficiency of the body. I worked hard in researching this information to simplify it and share it with as many as I can reach, to educate those with diabetes and their loved ones. Number one, because there are so many misleading information and guidance out there from people that just don't know any better. And so I wanted to provide practical information, truthful information about the risk of diabetes and what can be done now to prevent that from happening, or if we have diabetes, how to improve our odds of not having this disease become a debilitating ailment. Also, I want to enlighten those with diabetes as to some other complementary alternatives in caring for diabetes, which massage absolutely is a holistic modality that can be shared with people with diabetes and with other diseases. So my desire is every month to share a new topic and how that topic can benefit from massage therapy. I plan on sharing topics such as cancer, autoimmune disease, Lyme disease, mental health, sexual dysfunction, and even teens and massage therapy. So I will look forward to talking to you in the near future. And please do yourself some good and go book a massage.